The spread of COVID-19 across the globe has been devastating, with millions of deaths, hospitalizations, financial hardship, and social isolation. No one could have predicted just how impactful the virus would be. But now over 24 governments and global agencies are exploring an international treaty to prepare for future outbreaks. European Council President Charles Michel first laid out the idea of a pandemic treaty at the UN. It would address things like monitoring, mitigation efforts, and the response to new viruses. Amid the COVID-19 pandemic, China faced criticism for how it handled the initial spread. And as for more and more cases were reported, many governments struggled to effectively prevent further infections. Though even with the creation and distribution of vaccine, a number of nations are still being left out. In a recent briefing, the World Health Organization's Director General said, "The world cannot afford to wait until the pandemic is over to start planning for the next one," saying the treaty would provide a framework for international cooperation and solidarity. The lack of such cooperation is now on full display, as the agency pleads for rich countries to immediately donate 10 million COVID-19 vaccines so that immunization campaigns could start in poorer places, but they are facing an uphill battle, as many nations focus on their own populations first. It's a lack of action a pandemic treaty would address. With the 25 signatories of a commentary expressing the need for a framework calling for solidarity and greater societal commitment. But for now, there is no official move to change the approach to pandemics. And 3 world powers necessary in achieving such a goal, Russia, China, and the United States, were absent from the commentary. I'm Tolly Anderson reporting.